Some grim reading with the latest COVID-19 updates. The source I mostly use is Worldometer. Um, it's an online site that takes data from the Johns Hopkins University, so it's a fairly reputable source. Except the figures for China are obviously going to be a massive underestimate. As we know, it's highly unlikely. The figure for China is just 3,300. But basically, as it stands, it's now 2:25 p.m. on the 3rd of April 2020. UK has had 3,605 deaths and 38,168 cases. This represents 684 more deaths in the last 24 hours. Um, and that sort of daily increase is steadily going up. A few weeks ago, it was about 50 a day. Then it was going up to 100 a day, thereabouts, and 500 a day. Now we're seeing almost 700 a day. Another way to look at this is if you consider all the deaths in the Troubles in Northern Ireland over 40 years, about 3,500 people died in the Troubles. You'll see differing exact figures, but about 3,500 people. So this toll now represents the equivalent of everyone who died in the Northern Ireland Troubles over 40 years in just 2 months. Um, and I know the caveat here. I know that you can say, well, seasonal flu kills more people, but the thing about seasonal flu is it's not quite consistent. So, for example, in the year, I've done a bit of research on this 2014, 2015, some 28,000 people died of seasonal flu in this country, which was a particularly bad season. Yet in another year, 2018, 19, it was just 1,600. So it isn't kind of a generic figure, and that's probably why Public Health England doesn't keep figures on it. It may be a good idea to do so, just so we can put this thing in context. So what needs to be understood is that when people say it's just like the flu or the flu kills more people, that may be true technically, but the rate of mortality with coronavirus is higher. So, according to the World Health Organization, only 1% of those who get the seasonal flu, which will be tens of millions of people around the world, only 1% die from that. With coronavirus, it's 3.4%. So, it's three times higher. And that's why we're taking this more seriously. Um, at some point, I want to make a video about the 2009 pandemic versus this pandemic because I do think it's interesting that that seemed to get a very different approach. It didn't seem to be the same sort of public reaction and lockdowns and so on, at least not to this extent. Um, so anyway, that's the latest news, and that means that Britain has now had the highest daily increase of any country today. Not the highest toll overall, but the highest daily increase. We've now surpassed Spain in that regard. Um, if you look at the figure on Worldometer for new deaths, it's the UK, Spain, the Netherlands is surging, Iran, Belgium, Switzerland, Portugal. Um, and the Philippines is starting to get a steady increase as well, where President Duterte has ordered a shoot to kill policy for people flouting regulations. In Ecuador, in the largest city there, Guayaquil, there has been an issue about space to bury bodies. So this is something that is really impacting every country. Statistics on Worldometer, I'll just quickly run through these. Worldwide, there is now over 1 million confirmed cases. The true figure is almost certainly going to be a lot higher, but that's confirmed cases. Deaths, 55,163, and again, the true figure will be a lot higher. I think, especially in China. Probably you can add another 100,000 to that. And not just China, there may be other countries underestimating or underreporting the true death toll. Um, but even, yeah, so at the moment, Italy still has had the most official deaths, 13,915. Spain is close to 11,000, 10,935. Then the United States, 6,098. France, 5,387. And we're now fifth in the world. We've surpassed China officially but the true toll in China is going to be a lot higher. So it's grim reading. And the thing is, each one leads us a personal tragedy. And what I find striking and alarming about this is the growing number of young people who are dying. In the beginning, it was older people with pre-existing conditions. It's still tragic for their families. I wouldn't downplay that. But when we're seeing young, healthy people succumbing, um, like the British ambassador to Hungary recently, he was only 37, um, praised by the Foreign Secretary. It's striking. That's why I don't think we should just treat it like, oh well, the flu kills more or whatever. It's There's different dynamics to that, I think. Um, but yeah, that is the latest figures. For my next videos, I'm going to be looking at the 2009 pandemic because it seems the whole world forgotten that. And yet it was officially, it only killed 18,000 people according to the World Health Organization. Unofficially, it could have been up to 500,000, which is more plausible. One thing about this I'll quickly mention. I think different countries may be looking at this in a different way. For example, a big question has been why has Germany, as the most populous country in Europe, seen relatively fewer deaths compared to Britain, France, Spain, or Italy? I think there could be a lot of factors for that. One of them could be the different social structure. So, for example, in Italy, there tends to be more social interaction between old people and young people, whereas in Germany, not so much. Maybe old people are more in nursing homes or living on their own. But then that's also the case in Britain. So I'm not sure if that is a factor. It could also be that the German statistics are only taking into account people who are directly dying from COVID-19 rather than dying as a sort of, well, have pre existing problems and the COVID-19 is exasperating that. But even the deaths that we're hearing all these things like this person had pre-existing problems, the issue is that COVID-19 has kind of been, I don't want to be crude about this, but the straw that broke the camel's back. In other words, yes, they had pre-existing conditions, but it's still COVID-19 that was the ultimate cause of death because it has exacerbated the other conditions. So yeah, last night I have to say we had a very good turnout in my street for the Clap for Our Carers initiative that was started by that young Dutch yoga teacher. It's a great idea. It's very important that NHS staff know that they are appreciated. These people working around the clock, they even kind of responded. They clapped for us. So they had a clap in Lewisham Hospital, in a hospital in Lewisham, I should say, to kind of thank us for staying at home. So there is a kind of communal spirit coming through with this. It's a bit like the people playing musical instruments from their balconies in Italy. There is a communal spirit coming through, and I think it is something that will stand out and be remembered for this. There's other things that are a bit more light-hearted, like the group of goats that had taken over Llandudno, so Wales. So that's the latest statistics, and if we keep going up at this rate, it's going to be over 4,000 tomorrow. At some point, we're going to be seeing close to 1,000 deaths a day. The government's target is to keep this under 20,000 deaths. If we're looking at this continuing throughout the year, I think that's quite optimistic. I think we're going to surpass 20,000. Okay, you could look at it, we're a nation of 68 million. So, in that sense, it's still a very small number. But each one of these is a personal human tragedy. There's families involved, and particularly when doctors and nurses are dying on the front line, they really are sacrificing to help others. So it's a sobering thought, really is. Stay safe.